Thank you for the opportunity for actually speaking, and just to sort of flesh out what Don was saying. So I'm actually a health professional by background, but I've been a union official for the last decade, and that's given me the benefit of a front row seat to the pandemic response in Victoria. And so what I'd like to do is talk to you about what we did well and what we did poorly, and in terms of the outcome. And for those of you unaware, Australia did pretty well in the pandemic response in the first couple of years, and then it kind of went pear-shaped from there. But within that, Victoria had a pretty bad outcome in the first 12 months, and there were a lot of lessons learned in Victoria from that. And so what was happening on the ground was that the government was meeting regularly with the health unions, the leaders of the health unions. So we actually had weekly briefings, and we also managed to get weekly briefings with the PPE task force and the chair of the task force. And that gave us a direct input and direct feedback and direct consultation with what was happening. But the big thing that happened was that there were about 4,000 healthcare workers got infected in Victoria over that period, and they realised that there was a big problem and in terms of the workspaces, and so they put together a task force, and they called that the Healthcare Worker Infection Prevention and Wellbeing Task Force. And several of us union leaders were on that task force, and that was really instrumental in terms of shaping the way the Victorian response went from that point on. Important achievements out of that task force that largely went unheralded was we were the first jurisdiction in Australia to actually put out a statement recognising COVID as being spread as airborne, and that was a big thing, because then that influenced the PPE guidance from there on. The Victorian Health Building Authority actually updated their ventilation guidance after that. It meant that the Chief Health Officer, when he was doing his daily press briefings, he would quite often mention the fact that COVID was airborne. So that was really important for us, and that was a big step forward. We also managed through the task force to generate an audit of the ventilation standards in COVID wards in 20, I think it was ended up being 21 hospitals. Unfortunately, that report was never made public, but the report demonstrated that there was a real failure in terms of the standards within those spaces. And as a consequence, the hospitals started gradually improving their ventilation standards, and they're still going through those processes now, 3 years later, in terms of the upgrades. But it also led to what they called, they did a hotspot study, which is actually a publicly released document, which demonstrated the spread of aerosol particles throughout a simulated ward or bed space. So that laid a really solid foundation for us as health professionals to demand proper respiratory protection in the workplace. And that led to the task force implementing respiratory protection programs. So that meant that all the health services then had to go through fit testing of their N95s. That meant that all the health services had to produce a COVID-safe plan. And so all these outcomes put us on the right path and meant that we were actually heading in the right direction. That all went a bit pear-shaped, 2022, the end of 2021. And so there's still a lot of work to be done. But from our point of view, the foundations are there. And what I wanted to share with you is in terms of things that worked and things that didn't work. And the things that really worked for us was getting organised. We collaborated. So the health unions or the leadership, we met offline and we collaborated. So when we met with the government, we were all on the same page. We didn't always agree with everything, but we would caucus beforehand, and we'd get a consensus position, and we would put that, and we put out joint press statements, and we would write letters and co-author them to the Premier or to the Health Minister. And they were very powerful, and it meant that they were helping to push the direction that we wanted to. And as I said, that's led to some better outcomes. What didn't work so well? Well, the regulator, the Work Health and Safety Regulator, was disappointing in terms of their response. We managed to meet with them regularly. So don't rely there. Communication was was one of our important things, and communication from the government was not always to the health workforce was not always ideal, and so the unions really took up that space. It's important to keep the pressure on, and don't expect gains straight away. Don't expect big gains. Take the little gains when you get them, and if you don't get them, go back again. You think of yourself more like a terrier than a greyhound, so you got to keep nipping away and keep chipping away. Don't always accept no for an answer. As Michael just said, I think the previous speaker just said, if you can't find an answer where you want it, move on and go again and see how you go with the next area. So think of yourself as, and most of us here may not think of yourself as, but think of yourself as an activist. Every opportunity you can, put your hand up, get involved, get on committees, speak up, and do your part. Be patient. Governments and bureaucracies move slowly. Look for allies everywhere. Sometimes they're not where you expect them. But if you speak to people and you get involved, you'll find them, and they're there. Don't let aiming for perfect, undermine a good outcomes. You can't always get. I mean, as a union official, we're used to not getting what we want, but we always try and get better than what we had, and we just need to keep pushing forward. And ultimately, I think to some degree, lawsuits are going to start to force the hand of the governments and the employers, and so we will see change. But in the meantime, do the best you can, keep pushing forward, and stay safe. So thanks, Dom.